I'm Georgina Aasgaard. I'm a classically trained cellist and music and health practitioner based in Liverpool. Alongside my performing career, I've always been working in a variety of health and social settings, as I have a real passion for taking music from the concert hall to more intimate situations and experiment with patients and members of the community the incredible power music can have on our mental health and well-being. The starting point of arts and health partnerships is to establish relationships, whatever the context is, and to build on them. Creating relationships is an intervention of its own, and good relationships at all levels are key contributors to good healthcare. Organizations must pay great attention to the choice of practitioners or artists when they set up a partnership. There is a multitude of approaches, but I believe a successful partnership in any setting is based on who delivers the interventions, recognizing the skill sets, the values, and the attitudes required to deliver creative sessions. Arts in health projects can be set up successfully by creating a pilot intervention, which will take into account many essential factors, such as visiting the site, considering the environment, understanding the context, and taking the time to meet all parties involved and discuss each other's perspectives, aims, and objectives. It's really important that organizations trust their artists and let them experiment and find their own way of working within that specific context. When organizations implement pilot projects, they must make sure that they are evaluated efficiently and then co-produce and co-learn with their partners. They must establish everyone's role clearly and establish a shared identity between partners by always considering different perspectives and different workloads. Power shifting is really important when it comes to decision making, so that all voices, ranging from managers and policymakers to facilitators and participants, can be heard on an equal level and that the relationships are respectful. I think practitioners can really help in building the access routes to arts and health projects because they are on the ground, they are initiating the relationships with participants, they can spread the word and establish trust. So ideally, they need to be part of these access routes in the planning stages of the projects. I am currently delivering a songwriting project with a group of women from Sudan in Toxteth who suffer perinatal mental health issues, which has made me realize how isolated certain communities in the city are. I believe that by being on the ground, again creating relationships, making friendships, showing kindness and care, we as practitioners can open up a cultural and knowledge exchange, a dialogue that needs to be supported by arts and health organizations and that can be so enriching for all parties involved. As an effect of the pandemic, technology has become an essential part of our daily lives, so it is not surprising that digital resources have been explored and developed by many different sectors. Innovation in technology, when it comes to arts and health, has a huge potential to amplify social impact and change, as well as reducing our environmental footprint. Development of apps and online provisions and resources have made arts and health interventions much more accessible and have also widened audiences. In this current climate of crisis and emergency caused by the pandemic, austerity, globalization, racism, war, and a mental health epidemic, the arts can give us all a sense of hope. Arts for health interventions have the potential at any moment to change someone's life. We may meet participants once or 20 times. It's what happens in the moment that matters. Successful arts and health partnerships can give a choice and a voice to people who are not listened to in society. They can create a safe space and foster a sense of belonging, which we all need.